The total toxic burden isn't just what is going in your bucket or your body. It's your body's ability to identify it and get it the heck out. We're genetically losing that ability.
Large population where I'm seeing this is the patient population who went on these GLP-1s. The patients that go on Mounjaro or these other things, as they're losing fat, they are releasing massive toxins into their bloodstream. And all of a sudden, there is this massive toxic burden that their immune system has to deal with. It starts affecting the brain, starts affecting the kidney.
There's no one size fits all.
So there are some patients whose cancer cells upregulate the GST pathway, which is where you make glutathione that we want to defend ourselves from toxins and other things. But in some people, their cancer is turning that on to make more glutathione to protect itself, the cancer cell, against the chemo agents. So we would never want to give a patient glutathione knowing that that might make their cancer worse.
We're supposed to take medication, supplements, mindfulness, and put that in our toolbox. We're supposed to be looking at each person individually.
Hi, and welcome to another episode of Health Frontiers with Dr. Bob. I'm Dr. Bob, and today we're really thrilled to have two wonderful guests with us. And these guests are the directors of the Functional Medicine Center of New Jersey. And this is Dr. Nicole Anderson and Dr. Kelly Blundy. I'm really excited to have them here, and they are real experts. I'm going to introduce each of them. The first one is Dr. Nicole Anderson. Dr. Anderson is an MD, and she has spent over 25 years practicing pediatrics and neonatal intensive care at the Children's Hospital of Columbia University in New York. When her own daughters developed chronic illness, I think this is important to know, she shifted her career towards functional medicine, training under world-renowned Lyme expert Dr. Richard Horowitz and earning multiple board certifications. She is also certified in hyperbaric oxygen therapy by the International Board of Undersea Medicine. That's interesting. Her passion lies in helping patients with chronic infections, mold and toxin-related illness, hormone imbalances, and complex inflammatory conditions. Welcome, Dr. Anderson.
Thank you, Dr. Bob, for having us.
My pleasure. And we're now going to introduce Dr. Kelly Blundy. Dr. Kelly Blundy spent nearly 2 decades transforming lives through a root cause approach to wellness. She holds a doctorate in chiropractic and a doctorate in natural medicine from Logan University, as well as certification from the Institute for Functional Medicine. Her training includes hyperbaric oxygen therapy, integrative medicine, and detoxification. Dr. Blundy's focus areas include gut health, thyroid and hormone imbalance, or balance, I should say, metabolic optimization, and environmental toxicity. Both of these ladies have an extremely interesting passion for functional medicine, something that all of you out there are extremely interested in. Members of my family, for example, are really tied into this, and we're just so delighted to have both of you on the show today.
Thank you.
Thank you.
Sure. I'm going to start out by talking about the American Medical Association's feelings about supplements and vitamins. And this is important for those of you who are professionals or non-professionals. The AMA statement, and this is from Sarah Berg, who's their news editor for the AMA, vitamins and nutritional or dietary supplements might be beneficial to your health. They can also cause health risks. Notably, the U.S. FDA, or Food and Drug Administration, does not have the authority to review dietary supplemental products for safety and effectiveness, as we do with, say, anti-inflammatories or other immunologic or cardiac drugs. So their effectiveness before they're marketed is really unclear. And with the FDA estimating that there are more than 100,000 different supplements on the market, it can be confusing to understand what is safe and what is not. So I hope after today, you get a whole different view of functional medicine and these supplements. So I'll open it up to ask you about safety and the FDA. What do you think about all of that?
I do agree with what the FDA said. I think that one of the things that both Dr. Blundy and myself teach our patients is that you need to understand who you are genetically,
yes,
where you are at this moment in time. Are you in a position where you're micronutrient deficient.
Yes.
Understand how you're living your life. And after we determine that, we can determine specifically which supplements you should be taking. But there are a host of supplements that if certain people have certain conditions like autoimmunity, they should not be taking, and it can actually cause more harm than good.
Yes.
So I agree with them that it needs to be administered under the direction of someone who's trained to evaluate you and then prescribe it safely.
There's no question that there are medical conditions, such as people who have cancer or are undergoing chemotherapy, those who have severe metabolic illness, those who have severe diabetes with all sorts of side effects. Supplements are really important for them. And I really would like to know what supplements those patients might have that would help them.
Well, I would say before we talk about supplements, I would first say, what's everything going into this person's body? What food are they eating?
Other medications, for example.
Yeah, other medications. I mean, a lot of functional medicine is looking at the whole person. And instead of saying, we're not here to say, take this supplement instead of this medication for this symptom. That's not what functional medicine is about. Functional medicine is looking at the entire person, figuring out what lifestyle factors, their genetics, what predispose them, what their environment is, what they're putting in their body, how are they moving their body, what is their stress like. There's a whole host of things that we're looking at because we don't really feel or believe that one thing is leading to all these diseases. We think it's a multitude of things. So we're looking at those things and saying, okay, well, first, what are you putting in your body? Are your cells, is your gut lining in order? Are you able to even absorb these things? Because the idea is not to just get people on a bunch of supplements. It's to fix a system and having them eat nutrient-dense food and then supplementing them with what maybe they can't get enough of or they don't like to eat. So I think that's so important to talk about that.
Yes. Well, some of my patients, mortgage their homes to pay for supplements. And literally,
we don't
and when I
recommend
was in New York City, that was the case.
Right.
And my family members, one in particular, my wife, she has boxes and drawers full of supplements. She's an artist, and, I would expect that she has somewhat of a different view of nutrition, et cetera. But she's doing very well, and she has prospered with her supplements, especially when somebody in the family gets sick. I mean, she'll use things, I'll mention, echinacea or other supplements that will help them get over an acute infection.
Right.
And I'm sure that's the way you think.
So I do, but I don't also. So understand, this is a perfect example. So your passion, autoimmunity.
Yes.
Let's just talk about that for a second and supplements. For my patients who have positive ANAs, who have autoimmunity, there are certain supplements I would say do not take because they're going to overstimulate the immune system. So echinacea, ashwagandha, cordyceps, rhodiola.
Very important to the patients that are watching.
Do not
those of you with autoimmune disease.
Because they can actually worsen your autoimmunity. And that's something that
they boost the immune system.
They boost the immune system. If your immune system's dysregulated and that whole, Th17, Th2 side is upregulated, you're going to get worsening autoimmunity, worsening allergies, worsening mast cell activation. So you do not want to take those things. And that's a perfect example of somebody having all these things in a box and handing them out to family members. It has to be done responsibly.
Yes, and she mentioned the Th2, and we're talking to different T cell populations.
Right.
The T cells and the B cells are an integral part of our immune system. I write about that all the time. And this is very interesting because, the doctors are approaching your nutrition, looking at the quality of your immune system and the different components of the immune system, which is really something that most alternative medicine people do not do, although the legitimate people, such as yourself, do consider things. Let's take vitamin D, for example.
Right.
Now, everybody comes in and wants vitamin D and there's been stuff in the national media about vitamin D being excellent for immune function, especially in those patients who have immune disorders. But we know that over 4,000 units a day is probably toxicity. So how do you handle that?
So, You're talking about a dose. So
Yes.
a dose of a medication, you don't know what toxicity is until you measure it in someone's blood. And when Dr. Blundy and I send blood work, we don't just even look at your serum levels, which allows us to understand the absorption across the gut, but we're looking at your intracellular levels because that lets us know what's in the cell. And then the repercussions of taking that. So we will follow your calcium levels to see, are you overabsorbing? In addition, we look at your genetics and we look at your VDR, right? That SNP that allows us to know how that vitamin D receptor works. Because if you have an alteration and your vitamin D receptor isn't working well.
That's the VDR you just mentioned.
You may not be able to, at normal levels of 50, have enough of that vitamin D to get intracellular. So we look at the picture in a really detailed way from a genetic standpoint. What's happening from the gut, right? Are you eating enough?
Right.
Does our food source in our country have enough of these things that they need to get in? Are you absorbing it into your blood? And then can you get it from your blood inside the cells? Is there membrane dysfunction that doesn't allow you to move it into your cells to use it? And then what are the repercussions if you do get that inside that we would expect? And like I said, for vitamin D, we could use calcium, for example, to get an understanding, are you toxic? Because a vitamin D level of 50 or 90 or 100 means nothing until you understand what that means in a person.
Got it. Okay. That's very interesting.
It's also important, I mean, especially with how we practice functional medicine, is that, we are following patients' labs and making sure that we're not just handing something out and not responsibly following up with how it's working in their body. And I think that's a lot of it. Everyone, you can't just say this exact dose is okay for everybody. Everybody has a different way that their liver processes it. They have different genetic SNPs that either make them have a fast metabolism or a slower metabolism.
Yes.
So what you're going to give to one person should be very different than what you're going to give to somebody else. I mean, even as a medication, we just don't go, hey, here's what we're going to give everybody this dose, no matter, you're looking at data and then making that determination. So
very, very important.
And I think to your point about vitamin D, I mean, the VITAL study, right? That was something that we all did, 2-3 years ago, came out and showed that using fish oil, right, and fish oil with vitamin D actually reduced the incidence or the onset or presentation of autoimmunity, over a period. You could get it from 15% with omegas, and then you add vitamin D, you got it down to 30% reduction, and that lasted for a couple of years. Understanding that there are such powerful, simple things that you can take, but let's go back to what we were talking about before. What about eating these things? Right. What about lifestyle, right? Obviously, we live in New Jersey, and it is not so easy to stand out naked in the middle of the winter and get enough vitamin D. So,
well, it depends on where in New Jersey you are.
But also just talking about
New York City.
Talking about incorporating the linolenic acid and linoleic acid into your diet and making sure your B vitamins. All of these things are great, so you can convert them down to the resolvent levels. These things are it's critical to understand everything, but we focused first on the foundation. What are you eating, drinking, breathing, right? How you're moving, the stress, the sleep, and your community before we even talk about supplements, right? Obviously, that's where we want to start. And then we add in after, understanding who you are.
So you do take into effect stress.
Absolutely.
Stress is extraordinarily important. And people in our society, now, I would say in other parts of the world they're not, but in other parts of the world they're more stressed than we are. If you take war-torn countries, I happen to be very interested in this right now because of my studies of epigenetics and epigenetic change on both the immune system, the incidence of cancer, and neurodegenerative diseases. And I'd like to talk about all of those things a little bit so that our audience will be intrigued, as I am, about this whole topic. So what do you think about stress and stress levels? And are there things that are supplements that can de-stress you?
Well, I think we have to define stress. Everybody thinks of stress as I had a bad day, somebody upset me, or they say, I'm not stressed, I feel fine.
Right.
They don't understand that all of the toxins that we're putting in our body is a stress. Physical pain is a stress.
Right.
Your body doesn't know the difference between a lion ready to eat you and somebody just cut you off on the Garden State Parkway, right? You're still going in that fight or flight, sympathetic overload. Your adrenal glands are dumping cortisol, DHEA, epinephrine, norepinephrine, aldosterone, right? So, and we have this conversation, especially when we talk about menopause. We're like obsessed with the sterogenic pathway, and we would love it up here. But just talking to patients about the fact that you can't just go on a hormone or take a hormone or a supplement, and it can go all different ways depending on what your adrenal glands are doing or what your stress response is. And so I think the biggest part too of what we're doing is educating the patients too on this.
There's a big science behind it.
Right. I mean, yes, there are great supplements, and some of the adaptogens you have to be careful with. Ashwagandha, obviously, if you don't have an autoimmune state going on and you're not dealing with that. But magnesium and, even essential oils, just as lavender and some of those things that could be very calming. I think people just taking a moment to just pause and breathe. Not forget a supplement, but breathing, tapping, meditation,
yoga.
I think that's the one thing is there's no one size fits all. We're supposed to take medication, supplements, mindfulness, and put that in our toolbox.
Yes.
And we're supposed to be looking at each person individually and personalizing a plan to them.
Yes.
And I think that's what we're so passionate about and really want to get other physicians and other people to do that as well.
And I think that to also understand that we have the ability to do more specialized testing to really look at somebody's cortisol levels, DHEA levels, understand throughout the day what's happening, right? And obviously, we look at the cortisol curve to try to get an understanding.
Do you actually do endocrinology in your center?
We do. So we look, and we prefer salivary testing because it's going to let us know the free hormone that's out there, and that the cells are seeing. But it allows us to, when we sit with our patients and we talk about their days, it allows them, one, to see, are they waking up stressed immediately? Or are they waking up with a low cortisol curve because they're just burnt out, like wired and tired? And then what's happening throughout the day to drive their cortisol up? Understanding, as Dr. Kelly mentioned, there's everything from toxins to infections to gut issues. The inflammation from the gut, dysbiosis, food allergens, infections in the gut. All of these things play into it, but also who you're interfacing throughout the day with, how you're living your life influences it. Are you sleeping? And one of the biggest things that I see is this prolonged fasting driving cortisol, which is, right, people forgetting. They'll come in and they'll say, but I'm not eating white processed foods, I'm not eating sugar. And their cortisol's through the roof, their blood sugars are all over the place. People need to understand that the way they're living their life, even though they may think they're doing it well, right? Prolonged intermittent fasting can spike your blood sugar because your blood sugar drops. You get a cortisol surge, and you get another blood sugar spike. It's up and down. But we see that with extreme exercise too. Right. So it's not just the sedentary life that creates inflammation. It's not just the toxins that we're seeing.
It's over-exercising.
And it can be
overdoing
the extremes.
And
that's very important. We've got to touch on that.
And
that's
I think
heavy.
that's something for everyone to realize. So we can get this testing, and we can sit with our patients, and they can see what's happening inside their bodies, and it makes them more amenable to make the lifestyle changes, to use these other things, like we talk about breath work and, eating appropriately. So as Kelly mentions, one of her 4 favorite things is not spiking your blood sugars. That means not letting them go too low, not letting them go too high, because you want your cortisol curve to be nice and
Well, the cortisol curve is extremely important too, and hormonal regulation is critical. And I talk about that in one of my books. And for the immune system, which is only one part, probably one of the most important systems in the body, the hormonal levels shift and come and go, and not only in women but also in men. And we could talk about gender differences, and we could go into that right now, and then formulate our whole proposal going forward based on the genders of people. So do you find that men are different than women with regard to stress and with regard to the need for supplements?
No.
Yeah.
No. I think that we are right now seeing a massive increase in men who are going through what we call andropause.
Okay.
No different than menopause.
Interesting that you mentioned that.
And I think that we are seeing an equal number of individuals coming in asking for supplements, asking for hormonal replacement, and I think it all goes back to the same root cause. I had a meeting today with Paul Savage, who is one of the amazing toxicologist in our country, who is leading the way with therapeutic plasma exchange and creating these centers with Pam Smith, who's another incredible physician. And what he said to me today, and it was shocking, he said that our country, the United States, is the third toxic area in the world. The third toxic. No, he said number one is the Middle East. He said the second is the Russia-China area with the toxins. And the United States, not North America, the United States is number three.
Now, when you say toxic, what do you mean?
We're talking about everything from the environmental toxins.
What they're spraying on our food.
Right. So we're talking about plastics. We're talking about insecticides, pesticides. We're talking about these forever chemicals. We're talking about mycotoxins, right? We're talking even tick-borne illnesses. But mostly when we talk about toxins, it's really those environmental toxins. And we know that every year there are more and more being added, and our bodies are being taxed in a way, both men and women equally. Now, obviously, women may present with autoimmunity at a far greater rate in their 40s and 50s.
Yes, which I think is epigenetic. We've done work at Stanford University, and this is all very, very interesting. And it's long non-coding RNA, just to give you a little hook, because it was published in Nature, I think, about a month ago. And so that is a hypothesis that's being proven as to why women predominate with the autoimmune diseases.
I don't know if you've ever read any of Lisa Moscani's work. She was at Columbia, now she's at Cornell. She does a lot on women and brain health and hormones. Mm-hmm. And early on, before she kind of pivoted and started looking at the way women's brains change with the change of hormones, she actually presented a paper showing that women retain their children's DNA in their bodies for 25 plus years.
Yes.
So the question is, those of us who have had children and now have this retained DNA that is not ours, how much of that may also be contributing to the presentation of autoimmunity?
That's
because
been
we're being taxed.
A popular hypothesis over the years.
Yeah, and it's something I always think about. Like, are we being taxed more than our male
That's very
partners?
Interesting, very interesting. So I think that the gender differences are really important. But you touched on something, and that's the toxic nature of our environment. Yeah. And, everybody's down on Robert Kennedy, our new Secretary of HHS, but in fact, he seems to have hit a nerve with regard to the toxicity of dyes in our food. And PFAS right now is very big in well water and in water in general around the U.S., and other toxins like microplastics. And I had a guest on this show recently talking about silicone implants. These are saline implants, which are supposed to be safe, but apparently fragmentation from the silicone breast implant, mostly women, there are men who have implants as well, wind up with accumulated micro silicone fragments in their circulations and certainly in their brains. So you're on to something really big here in that regard, and this is really important.
I think we have to look at, and I always say this, it's everyone has a bucket. And it does seem that this country allows a lot of things to go into that bucket that maybe other countries have decided not to.
Yes.
And I think we're seeing, if you look at chronic health disease in this country, it's horrible. It's alarming. And you look at what this fake food really that we're eating most of the time. And then what is not fake is being sprayed with a whole plethora of chemicals. And listen, I understand, feeding more people and, making sure that, the insects and all the other things aren't, destroying our food, but it's coming at a cost.
Yes.
And when we talk about toxicity, and we do a lot of great testing and to look at what's called the total toxic burden, we're not just looking at the accumulation of all these toxins. We're looking at your body's genetic ability to actually detoxify.
Yes.
I say this to my patients, why can we have, somebody that can smoke a pack of Camels and drink Bud Heavies and live till 102 and,
right.
Somebody else in their 40s never smoked? It's not just, the total toxic burden isn't just what is going in your bucket or your body. It's your body's ability to identify it and get it the heck out. And we're genetically losing that ability. And also, I think, again, when we're doing these studies on what is a safe toxic level, I remember we were in the IHS and the conference, and I was listening to this pediatrician speak. And she had 2 bodies of these little children. And, the dots represented a toxin, right? And a toxin, each individual toxin by itself didn't look that alarming. But if you took every single toxin, even if it was at its infant amount, the picture looks like they have the measles or the chicken pox with the amount that it's filling up their body with. So it's blending these things together that's also that we're seeing. And all these triggers are leading to a lot of these autoimmunity and a lot of these chronic conditions that we're seeing today.
Right.
So I just don't think that we're in a world now where we can take one medication or one supplement and throw it at a person and say, this is going to solve your problem.
Right.
It's going to take work on the patient's part. And it's our ability to educate the patients and to communicate with them in a way that motivates them to want to change. That's the biggest thing. I think one of the most important things that's missing is the doctor-patient relationship.
Yes. Well, this is a very suspect area. Supplements have been poo-pooed by a lot of our professionals in various fields like endocrinology, et cetera. And it really has a place. Let's take cancer, which is occurring in young people now more than ever, especially colon cancer. Right. And it's an enigma that no one quite understands. And of course, I trigger it. I suspect it's the environment.
Absolutely.
That's one thing. So we can talk about cancer a little bit.
Sure.
People, like you mentioned, you can drink wine every day or gin, a pint of gin daily, and you can smoke a pack of cigarettes and live to a ripe old age, whereas someone else does that and they're dead at 50.
Right.
So this is really incredible.
So I think when it comes to that, it goes back to the same thing, is understanding your genetics, your genetic predisposition.
Yes.
Understanding what you have been exposed to and how you should live your life. And then really trying to minimize further exposure once we try to get these things out of you. But
Yes.
it really comes down to that. And also being cognizant of the choices we make, right? And I say often to my patients, if we lived like our great-grandparents, where you could grow it, kill it, or hunt it, you got to eat it.
Yes.
You did that. If you slept from sunset to sunrise, you got to do that. If you sat and you gave thanks and you prayed before you ate, you had periods where you brought your cortisol level down and your immune system was better regulated to survey for cancers and other things, right?
Yes.
I think our world is so skewed right now that we're not living true to the way that we should be living. Mm-hmm. And when it comes to cancer, there are toxins that we choose to take in, and then there are toxins that we're unaware of, and the repercussions of those alone, or as Kelly alluded to, in combination together,
Yes.
that could cause problems. But when it comes to supplements with cancer, we believe that if we understand the cancer cell itself, and we understand how that cancer cell responds to supplements, then we can safely do that. And we use a lab in Greece, RGCC, which allows us not only
In Greece.
Yeah, so we send it. So it's and initially I worked with them for supportive oligonucleotide therapy for tick-borne illnesses and chronic viral infections.
This is really heavy stuff,
But they have
folks.
been around for over 20 years. And what they do is they identify a patient's cancer cells.
Yeah.
And then they look at which not only chemotherapeutic agents best work with that cancer cell, but also which nutraceuticals are safe. So there are some patients whose cancer cells upregulate the GST pathway, which is where you make glutathione, one of your number one antioxidants in your body that we want to defend ourselves from toxins and other things. But in some people, their cancer uses that, is turning that on to make more glutathione to protect itself, the cancer cell, against the chemo agents. So we would never want to give a patient glutathione as a supplement knowing that that might make their cancer worse. There is testing available that will allow us, even for our cancer patients, to safely give them supplements that, some people may not even be aware is out there.
Right. So this is very interesting. And I just point to our audience. She's talking about complex metabolic pathways, but everybody's metabolic pathways are different. And you're tailoring the metabolic substitution or supplementation with the patient's own deficits, their cellular deficit.
Or depending on what their cancer cells are doing.
Right. So or which cancer it is.
And that's what these tests are able to do, which allows us to safely either recommend something or not recommend something. Because you're right, there are a lot of supplements that are you don't want to be taking when you're trying to fight cancer because it's counterintuitive.
Patients ask me all the time. We were earlier brought up echinacea, and people who have autoimmune diseases shouldn't be taking echinacea. Right. But this is a very interesting tailoring of, and you actually look at the histopathology. That means the biopsy of the tissue to see whether it's an adenocarcinoma or a squamous cell carcinoma or melanoma. Or
they actually do that. They do the blood and they look at the circulating cancer cells. And then they're able to look at the genetics of that cancer cell to be able to say, what is it upregulating or downregulating in order for it to survive and evade your own immune system.
Yes.
And then they're able to give us a guided breakdown of what is the cancer will
really
be receptive to. And we depending on the classifications, there's cytotoxic agents, there's immune modulating agents.
But PK inhibitors.
And we rotate every 3 months a supplement from each category so that we can help support them while they're doing this.
So you do that in your center?
We do, yes.
I mean, again, the number one thing is just a person's walking in. I'm not looking at them as a diagnosis. I'm not looking at them, I'm looking at them and really hearing their story. What got them to this level of dysfunction? What is really taken over their life to where they're not aging well. They're not living their best life. And every piece has its place of how they got there. And then that's how we're able to do the testing. And yes, they're coming in with a lot of patients are coming in where they went to other doctors and they have these diagnoses. And then it's our responsibility to make sure that we're doing our due diligence, which is why we like these tests, the testing, to make sure that we're not doing any harm and that we're only helping them. But again, I always come back to the lifestyle because I say this every time. There is no medication, there's no pill, there's no biohacking gadget out there that replaces what you do on a daily basis. If you are not treating yourself well on a daily basis, you're not going to be able to undo that with just a pill or a supplement.
Right. And you think activity, I mean, we touched on this, and that's Qigong, Tai Chi, Reiki. What are your thoughts about all of those maneuvers?
Love it.
The other thing, meditation. I think meditation is so easy that people should use meditation to relax.
So I think
to de-stress themselves.
Some of the movement things you talked about, what we often will say to our patients, and what I stress all the time, is you're not just moving for vanity.
Right.
You're moving first and foremost for detoxification.
Right.
You're moving to increase your brain drive neurotrophic factor, all these good things that you need for your brain health, right? Yes, people need to do, and to maintain muscle mass, right? And to keep your muscle on so that you can burn calories and burn sugar and keep your blood sugar stable. But these movements, any of those things are, like I said, if you go back, those are natural things we used to do in an environment, right? We'd interact with our environment. We'd go slow. We'd pause. We'd reflect. We'd breathe. We're aware of our surroundings. Now it's critical to do that, to slow yourself down, to get yourself out of that sympathetic tone, right, where you're in fight and flight, and get down into that other part where you're healing and resting and digesting, right?
Yes.
Well, to your point, because you said meditation, and everyone should be meditating, I agree. But nothing is worse especially I know as a female, I'm coming in, I'm angry, I'm stressed out, and you tell me to either not think about it, breathe, or meditate. I'm going to lose my mind. So that's where we try to come up with different things that we can help personalize. We talk about the polyvagal theory and vagal toning. If somebody is in a moment of distress, I'm like, gargle water, hum. Right? Those are two things.
Tell us about that.
Gargling water and humming will help reset the vagus nerve and stimulate the parasympathetics. And so we do little things like that because they might not be ready to say, listen, my life is stressed. I'm running around. I've got the kids. I've got a full-time job, whatnot. Meditate? When am I going to have time to do that? But when you start implementing these little things and they can see the power of that, then you can bring them to the point where they have the time to meditate.
Wow.
But yeah.
And to your point, meditation isn't just one thing, right? I made my husband do 21 days of meditation one summer. Every day we had to do something different. Now, I'm a terrible walking meditator. The idea of having to be mindful of every step I take, not my thing. And he struggled with it. And he is a surgeon. And I actually said to him, when you're in the OR and you're operating for 10 hours and all time falls away, and all you are is fixated on that tissue, and you lose sense of time, and you are completely present in just that moment, that's meditation. That is meditation. So everyone has it, right? They just have to find when they lose time and they can just be present in that one thing, whether it's a candle
I don't want to make
flickering,
light of this,
light.
but that's what happens when we play golf.
Yeah.
I
When the
agree
men's
because I'm
play
a
golf,
golfer.
You concentrate on the ball, address the ball, and you take everything out of your mind. That's the wonderful thing about a sport. You don't think of anything else. And that probably is a form of
For me, it's
medication,
running. I lose time.
meditation.
I'm
amazing.
the golf too. That was the first time I went out.
Yes.
And I remember oh my goodness, I just spent 4 hours and all I thought of was keeping my head down and my eye on the ball. And I'm in this, it's beautiful to be outside and you're grounding and you're one with nature.
Yes.
But yes, I can.
And running is another. You mentioned running, and I've heard from so many runners, and I used to be a runner, and you probably are an active runner. That is a form of meditation. I mean, because you can be totally out of sync with everything as you're running and concentrating on just running.
Yeah. Well, or you just are not even, you're just not there. Like it's just gone. You just are like, you get into that moment and like miles go and you don't even remember.
And there's bodily things that are happening, endorphins and other sorts of things.
I'm more of a power walker. I mean, we always make this joke that I don't run unless something's chasing me. And then I don't want to, and then the one time that we were at a amazing wellness retreat in Arizona, I did the Just Say Yes.
And I took her running.
She took me out, and I'm telling you, I don't know if it was Timon or Pumbaa, but this hairy warthog came running after us. And I didn't even know if she was okay. I just ran straight. And I was like, this is why I don't say things like that.
Yes, it's amazing. Amazing. A warthog chasing you in Arizona.
Yes, the one time I give into running, so.
But that's exciting. Now, let's talk a little bit about, first of all, let me ask you, do you think of fish oil? I mean, all of my rheumatologic friends are going to be watching and saying fish oil is preventative for joint disease. Are you in agreement with that and believe that?
Well, I think that there are definite benefits, but I'm going to give my quick and dirty, biochemistry thing.
Yes. Be as simple as possible for our audience.
It's really simple. We take fish oil.
They'll all go to sleep
fish
if we
oil,
get
and
too
our
deep.
intention of doing fish oil is because it's anti-inflammatory and it's trying to cut down that process. But if you don't have ample B vitamins, if you don't have ample magnesium, you can't convert that to what we call the pro-resolving mediators, which are the anti-inflammatory compounds that are the metabolites, the breakdown products of these fish oils.
Yes.
If you have high insulin levels, you block that ability to do that, right? I mean, you potentiate the ability to make it into the inflammatory
if you drink
mediators.
a lot of alcohol.
Right. So yes, it can be great. But for everyone, it may not be great because you may not get it to the form you need it to. Second thing, there is some literature to support not using fish oil in people who have AFib yet. We're still trying to tease that out. People who have atrial fibrillation.
Really?
There were some studies suggesting that maybe we should be careful about that it may potentiate it. So again, the VITAL study was one of the few studies that showed that it did maybe was preventative. We know that fish oil, if it can be broken down to the resolvins, we know that with MS, which I consider an autoimmune disorder, it decreases the progression. We know with RA, it decreases the joint pain. We know with lupus, it helps with the skin, right? And you get less skin reactive. So yes.
Along with vitamin E.
Yeah, but if you can appropriately get it to the form that you need to. So if you can't, because we know you may have, and we look at that, we will either give you the omegas, or we will give you what we call resolvins, pro-resolving mediators, which are those broken down products which will work directly on the cell, and you don't need to metabolize them.
And again, while we're making sure that we're working on those other micronutrients as well.
Right. But that's an example.
Mothers are telling their kids, take fish oil tablets like omega tablets once a day for their brain health.
How about, critical. Right? We need these fats for our brain.
Eating fish or sardines.
Better eat
the cold water fish.
Yeah, the cold water fish.
Cold water fish is very important. But even things like chia seeds. Chia seeds are high in omegas. Flax seeds. It isn't because, some people don't like to eat fish.
Good for brain health.
Yeah, algae, seaweed.
Right, right. Well, as immunologists, we've got all of these terrible things happening like alpha-gal, and I have patients with alpha-gal, which for those of you who don't know what that is, an allergy to meat. Yeah. And that is extraordinary.
Which we believe is kind of potentiated by the Lone Star tick.
That's correct.
That was down south carrying
it's coming north,
tick-borne illnesses.
So I had a lady who had alpha-gal syndrome, and she went to a barbecue and became anaphylactic from the smoke of the hamburgers that contained a certain particulate matter from the beef. So there are many, many new conditions, and there are many, many serious conditions. Toxicology, do you all concern yourselves with heavy metals?
Absolutely.
And how do you do that? Do you test people?
So the total toxin burden test I was talking about that I really like, it's Vibrant Labs does a really good job with it. It tests for a whole plethora of heavy metals, mycotoxins, and environmental toxins.
The mycotoxins are the mold-related toxins.
Yes, the mold-related toxins.
Alpha-toxin.
Yeah, I mean,
aflatoxin.
We know that heavy metals for a long time have been causing problems. They deplete us of other nutrients in our body, like iron and copper and zinc, and also are not good for our brain. And again, it adds to that pool of toxicity. When someone says, well, this level's okay. Well, maybe. But what other levels do you have in your body of other things that are in your bucket?
Yes.
So, and I think something that's really important because it is such a hot topic right now are the GLP-1s.
Yes. Good.
So
let me just explain to the audience. You know what the GLP-1s are? These injections, such as Mounjaro, Zepbound. I'm not trying to feature a particular product. Wegovy. Have I forgotten a couple? I don't know. But anyhow, those are the GLP-1s that make people lose weight. And it's hard to get those, except for Zepbound for weight loss. You have to be a diabetic, or you have to really need the other GLP-1s in order to get your insurance company to pay for it, unless you're wealthy and you can pay out of pocket.
So one of the things that we're seeing, and I have a large population where I'm seeing this, is the patient population who went on these GLP-1s. Now, understand, in a lifetime, you are exposed to heavy metals. You're exposed to other toxins. Many of these toxins are stored in your body. So what you may have been exposed to as you were laying bone down, right? Many of us grew up in a time where there was leaded gas, right? And we were laying down our body, we did.
Yes.
And we had leaded gas, and that's when we were laying our bone down. Lead, like calcium. Calcium is what we put into our bones to make them strong. Lead is also a 2+ charge ion, as is mercury, as is cadmium, as is arsenic, right? Think about that. So as you are having this lifetime of exposures and you're laying down your bone, these metals are competing for the same the receptors, and they're being laid down in your bone. The other toxins that we talk about are what we call lipophobic. They like to live in fat, right? Half of them like fat, half like water, like the mycotoxins or some of these other toxins we're talking about. So the patients that go on Mounjaro or these other things, as they're losing fat, they are releasing massive toxins into their bloodstream. And all of a sudden, there is this massive toxic burden that their immune system has to deal with and the rest of their body has to deal with.
Interesting.
Likewise, if they are not appropriately eating the nutrition that they need to, right, and they start breaking down bone, or they're going through menopause and they're breaking down bone, right?
Yes.
You start leaching these metals out into the bloodstream, and that starts affecting the brain. It starts affecting the immune system. It starts affecting the kidneys. The consequences are significant.
Right.
So, people who are on these medications need to be aware that as they lose the fat or they lose even bone mass, that someone needs to be following them. And Kelly and I are very passionate about our first responders, our police officers. And one of the things that this is another example that we talk to them, the police officers have one of the highest rates of cardiovascular disease, hypertension, renal disease, MI. This is a patient population.
They're under a lot of stress.
But they're under stress. But more importantly, they use firearms every day and lead. And no one is checking their lead levels. So we need to be cognizant because lead is one of the most inflammatory things to the endothelial lining. And once you start disrupting the endothelial lining, you start getting nitric oxide reduction, which is our vasodilator, right? You start getting renal injury. You set this population up for cardiovascular disease, and no one is looking at that component.
That's fascinating. I mean, the police officers that are watching, both male and female,
get your lead levels checked.
Get your lead levels checked.
We stop checking kids when they're little, right?
Yeah,
we do it when they're little, and then we never check anybody again.
I remember biting into a window. People used to use lead paint.
Yes.
And a lot of kids got poisoned.
Well, a lot of the toys, too.
A lot of the toys.
Had lead in them.
When I was little, I remember that. And it was very tasty because it was salty. And that was lead in the paint.
But we don't check after a certain age in pediatrics. We stop checking and screening patients. And when patients have hypertension, people should be checking for that.
And we're seeing a lot of it. I mean, the amount of even in serum levels, I'm seeing lead levels.
And you can easily send it to our regular labs.
Especially the women going through menopause, because as Dr. Anderson said, it's coming out of their bone as they're breaking down bone.
Yes.
And we're seeing, oh my God, why do I have these high lead levels? And it's all
mercury.
Yeah, it's all correlating.
Right. And mercury too, when people are eating tuna fish in huge amounts. I had one patient in New York City when I was there who had mercury toxicity, and it presented neurologically with paresthesias and all kinds of weakness. And we finally figured out that she ate, and she was Asian, and she ate canned tuna fish at her desk, 2 or 3 cans a week, which eventually built up this mercury toxicity.
We're seeing it on a daily basis.
And arsenic too. Arsenic is in crab and rice and in seafood. And so, a lot of times we'll tell, they come back, oh my God, my arsenic levels are high. They go to worst case scenario. And then we start going through, well, are you eating a lot of crab meat? Are you eating a lot of rice? Oh, yes. And very quickly when we remove those things from their diet, or we teach them to soak their rice and getting a lot of the arsenic off of it, their levels go down.
This is an eye-opener for everybody, all the physicians that are going to watch this and nurses, et cetera, because we really don't realize, the homeostatic mechanisms that are disturbed by lack of nutrients or too much of this and not enough of that. Let's go to neurodegenerative disease. Now, we talked about inflammation, and the big word, I think it was Time magazine or some magazine, talked about inflammation as the source of all problems. And inflammation is involved in neurodegenerative disease. And recent papers that I've read say, you're programmed genetically for neurodegenerative disease at birth.
So
what do you think about all of that?
I think Dale Bredesen out of Stanford has done he's given us the greatest gift of looking at neurodegenerative disease differently, especially this dementia population, the Alzheimer's population.
Which is so common now.
Obviously, there are genetic predispositions like the ApoE4. Without it, if you don't have the ApoE4 genes, 0, you have a 9% lifetime risk of dementia. If you have one, it's a 30% increased risk of lifetime of dementia. And if you have both genes are ApoE4, right? One from your dad, one from your mom.
So homozygous.
60 to 90%. But that's just your genetic risk. He's gone on to really shed light onto the things that create inflammation that predispose us to the changes cognitively. And he's grouped them into 5 different kinds of groups. The first one he talks about is sweet dementia, right? That's the idea of blood sugar instability, right? Elevated blood sugars create inflammation in your bloodstream, right? You take a sugar, you stick it to protein, it looks like bacteria, you have an inflammatory response, right? So looking at your blood sugars, that's one huge predisposing factor to inflammation. The next one, you start talking about the hot one, inflammation. So you start talking about mouth, periodontal disease, gut issues, right? Our gut, lay it out, size of a badminton court. That's how big that surface area is. Inflammation from there can actually be driving some of this because you get leaky gut. All these things like LPS, it's an inflammatory marker from the gut, crosses over the brain.
Lipopolysaccharide, and that's very, very endotoxin.
Yeah, and that starts causing really inflammation in the brain, and the microglia get activated. And even what we mentioned before, things like tick-borne illnesses, Lyme, Babesia, Borrelia, chronic
ehrlichiosis.
You can go on,
toxins.
And then you go on to even talk about chronic viral reactivations. We know the studies of HSV, CMV, right? The EBV, huge. COVID.
Yes.
So that is that other topic. And then you look at what we call PALE, micronutrient deficiencies, low hormones. We know that you need, estrogen. Women need it for their brain health in order to lay down memory and to it's their trophic factor for the brain. But the other issue is men need testosterone. And that's a trophic. Going back to the sugar, insulin, right? You have insulin disruption, you have insulin resistance. That's a trophic factor for the brain, meaning it helps the brain grow. Other areas that you have to worry about, vascular, right? Cardiovascular issues. So you need nitric oxide, I alluded to before, which vasodilates, gets blood to the brain. And the last one is, the idea of 2 more, the toxins, mycotoxins, and trauma, concussions. We see that with, our football players and others.
That's a biggie. And I had a neurologist on. We were talking about CTE, and it's a very, very important topic right now as well. And I intend to have a show on CTE, just on football and all the other head injuries that basketball players and whoever gets that, because that is a real problem that people are not aware of.
Do you want to allude to kind of our practice and what we do with our concussions? And
you handle concussion injuries and stuff?
Yeah. So, the traumatic brain injury that comes in, the first thing is we are going through a whole host of nutrients that we're actually putting them on right away to lower that inflammation, to get fat to their brain, MCT oil. We're giving them omegas, NAC, curcumin. Wow. We're really trying to help support the impact within the first 24 hours. And then that's where we get into a lot of the hyperbaric oxygen therapy.
Oh, that's right. You do have a hyperbaric.
We have 3 hard chambers. And I mean, a lot of, and everyone says, what's your protocol? And we're like, well, we're following the studies out of Israel. They have done probably the largest amount of studying on hyperbaric therapy and traumatic brain injuries. And I'm trying to layman's terms this, but we're able to get oxygen, to areas of the brain that obviously you can't normally get them to, and
labile areas,
and again beyond the cell. We're actually able to get it in the plasma. We're able to get it through areas that have been damaged vascularly, and what we're able to see is, it's one thing to study it.
Yes,
it's another thing to see the results. It's really incredible. It's giving people their lives back.
And for hyperbaric, like we said, initially our initial thing is we want to oxygenate in any place that may be vulnerable and not being able from inflammation or from damage.
Yes.
But also, the longer you're in, the more what we call dives, the more sessions you have, you start doing things like turning on your own ability to make antioxidants, turning on your ability to make growth factors that are going to heal your brain, and vascular endothelial growth factor, BDNF, all of these other things. You turn on the stem cells being better able to heal your brain. So hyperbaric is really critical. But another part, to go back to some of the things we were talking about, hormones, there is a significant number of individuals who, after a concussion or a mild or a moderate or even severe head injury, go on to develop within the first year, up to 60% in adolescents, some form of hormonal dysfunction, right? And that can be thyroid, that can be growth hormone, that can be the sex hormones. And we've already alluded to that estrogen and testosterone are critical for brain health. So we are very adamant after our patients have presented with a concussion to follow them closely to make sure that they are not developing these hormonal dysregulations. Because often what will happen if they're not followed, they present with weight gain, poor concentration, fatigue,
anxiety,
low libido,
stress.
anxiety, stress, and they're getting other diagnoses. And at the end of the day, it's really that they have hormonal dysfunction. If we can fix that hormonal dysregulation and support them through that, they don't end up on SSRIs or other medication indefinitely. And we're getting to the root cause and fixing the problem and helping their bodies heal.
Well, and if you look at all the anatomy, everyone just wants to look at the brain and a brain bleed. I mean, you have your pituitary in there, and that's getting rocked and inflamed. And that's why we're looking and we're seeing the downstream effect of how we're able to look at this a little bit differently and hopefully catch some of these things before they become a problem.
Well, this has been very fruitful, this discussion. We've actually been talking for over an hour.
Sorry,
and do you want to wrap up with a conclusion of any sort for our audience to tell them how, I mean, this is a whole new area for most of us, functional medicine and the approach to the whole body from the standpoint of steroid hormones, genetics, nutrients, toxins. I mean, I could go on and on. I've learned so much just by talking to both of you. So for our audience, any last words?
I think one of the things to understand is no matter who you go to, it's critical as the patient to understand your body best, right? To understand genetically who you are, not based on my grandparents and my family and everyone had diabetes. That's lifestyle, right?
Yes.
But really understand who you are genetically, as a bio-individual, and then understand how you have to live your life based on that and the things you've been exposed to so that you can age well, so that you can live well without developing all of these chronic illnesses.
Absolutely.
And I would say I'm going to talk about, just say, always pay attention to the 5 pillars. That's nutrition, sleep, movement, stress, and community. There's not one that's more important than the other. They all have to be equally balanced.
So extraordinarily
and medication and supplements and even hyperbarics is there to help aid once you have that foundation down.
Wow. Fascinating. And I want to thank you both for taking the time to explain to our audience all of this stuff, which is so incredibly rich with information and expands our knowledge completely. So Dr. Nicole and Dr. Kelly, thank you for coming out here tonight. And remember, everybody, this is the Functional Medicine Center of New Jersey, which is in Saddle River in Bergen County, New Jersey. It's a stone's throw from Manhattan. So I'm sure you're going to get quite a lot of visitors based on your discussions tonight.
We're passionate about what we do, and I think you can see that. And we really want to help change the narrative. We can see that very clearly, and we really learn so much. Yes.
And we just touched the tip of the iceberg.
I know. We need a whole series now.
Yeah, we need a whole series on
Weekly
this.
with Dr. Bob.
Weekly with Dr. Bob.
Health Frontiers with Dr. Bob.
Yeah, we do fireside chats. Fireside chats.
Fireside chats. Right. Okay, thank you all for watching. And you can get us on our website and our emails. And you can write directly to Dr. Nicole and Dr. Kelly in Saddle River at the Functional Medicine Center. Thank you.
Thank you.
Thank you for joining us on Health Frontiers. I hope today's episode provided valuable insights into your well-being. Remember, this podcast is not a substitute for professional medical advice, but a source of knowledge and guidance. If you have any questions or topics you'd like us to cover, please reach out. Make sure to like, subscribe, and visit our website at www.healthfrontierspod.com. Join us next time as we continue our quest to uncover the latest in health and wellness. Stay healthy and empowered. Until next time, I'm Dr. Bob.